I was supposed to record this and I haven't, so we're a little bit behind there. So the medications that may contribute to depression or anxiety, so contraceptives. So for many people for women, it's often the oral contraceptive pill that they realise that they just don't tolerate it very well. For some people it makes them feel quite anxious, and or it can make them feel irritable or a bit depressed. So I know that I experienced this a few years ago. This was with the Mirena contraceptive pill. So it's got progesterone in it. Sorry, the Mirena intrauterine device. It's got progesterone in it, or a artificial hormone. And what these contraceptives do is they shut down your own production of hormones, because your body is registering that you've got loads of the particular hormones available, so it starts to shut its own production down. The thing is that the synthetic hormones that you're getting aren't quite the same as your own hormones. They are slightly different. And some of your own hormones, such as progesterone, can have quite a calming effect on you. And when your body shuts down its own production of things like progesterone, you might get a symptom of anxiety, because you just don't have the exact same hormone circulating in your body anymore. So I know for a few people that they've gone on the contraceptive pill and they've found it awful. They really haven't liked it, and it's been a real issue. Corticosteroids, so these are things like prednisone. So for some people, if you've got a chronic pain or arthritis, you may get put on something like prednisone, and some people experience some mood changes from that. But generally it's mild and reversible once that medication finishes. Beta blockers, these are prescribed for high blood pressure, so hypertension. Some people find that it depresses their mood a little, so that obviously is a problem. I would assume that that's also one that will disappear once you stop the beta blockers. Statins is an interesting one. I've got some research about this. It's a little bit conflicting, but we do know that very low cholesterol can affect your mood. And you actually need cholesterol. So your hormones are actually made from cholesterol. Cholesterol is the first thing that hormones are actually made from. And so if you have very low cholesterol levels, this can affect your hormone production, amongst other things. So there is a relationship between low cholesterol and depression. You may have heard of Roaccutane, and it's used to treat acne, and I think it's relatively common. Actually, I'm not sure if it's so common anymore. There is some research that suggests that it can cause anxiety or depression. And there are some studies that demonstrated sort of increased risk of depression, attempted suicide and suicide following the Accutane treatment. However, there are some studies that show that it works as a bit of an antidepressant as well, and they think that that's because it works really well at actually getting rid of the acne, and for some people that in itself makes them feel better. I have had the experience before where this is when I was a nurse a number of years ago. Young boy came into the emergency department, sudden sort of onset of depression and anxiety, and really lovely kid. He was only 16, 17, and I did a full assessment, and I couldn't figure it out. There was nothing that seemed to be wrong. There was no sort of other precipitating factors, happy family. And the only thing that I could ascertain after talking to him for a while is that he'd started this acne treatment, about 2 or 3 weeks prior. So I actually rang the GP and had a chat to them, and they suggested it would be a good idea to stop, just in case that was the thing that was contributing to it. So yeah, that's another thing to look at. So protein proton pump inhibitors. So these are really, really commonly prescribed. You might all have a little bit in your cupboard. These are things such as Losec, otherwise called omeprazole, and they're given for heartburn normally, or for reflux. And there are some studies that suggest an associated risk with depression. They don't know the mechanisms of it. I do know that the proton pump inhibitors, they reduce the gastric acid production. And if you think about it from a sort of nutritional point of view, if you don't have good gastric acid or the ability to break down your food, you are likely to have less ability to actually get the nutrients out of it. So that's kind of a simple way of thinking about it. It might be that long-term use of omeprazole or Losec may contribute to that. There's no real other research that suggests why this would happen. And you know, if you're going to use these things occasionally, of course, it's not going to be a problem. This would be more if it's going to be used long-term. So these are some of the conflicting research about cholesterols and cholesterol medications. So statin use and risk of depression. So this was one study that said statins were able to provide protection against depression through the action of oxidators, so reducing the inflammation in the body. So they actually said that if you have very high cholesterol, which is inflammatory, and you go on a statin, so a cholesterol lowering medication, you actually have an improve in your mood because you've got less inflammation. And then there's other studies that suggest that if you have a total serum cholesterol levels that are consistently lower, that's often associated with depression and aggressive patients. So you don't want too much cholesterol, but you don't want too little either. So you do want a nice little balance. So, you know, if you do get your cholesterol tested and it's super low, that's not really ideal. Something else to just consider there. This is a little bit about the hormonal contraception. Once again, the research is quite conflicting. So we've got one person up here. This is one study that was looking at progesterone-dominant hormonal contraceptions can cause depression. And then you've got another research study down the bottom here, which says there is no link between hormonal birth control and depression. These things are really, really hard to study. It's not like you can get a whole lot of young teenagers and give half of them a contraceptive pill and half of them not. I mean, it's, as you can imagine, it's not something that you can easily study. So it's really difficult to know exactly. You could probably do before and after, but then it's really hard to know, well, what else has happened in this person's life? Have they just become sexually active? Is there other things that have contributed to their change in mood? So it's not easily studied and there's lots of conflicting information. But I just really want you to be aware that there are other things that contribute to mood and anxiety that aren't, that could be from medication, medication induced. This was just from the New Zealand. They were looking at medicine's adverse reactions. They actually did a full document into the risk of severe depression, anxiety, and suicidal ideation with hormonal contraceptives. So they actually have done a lot of research into that in New Zealand. And once again, they basically said it was really hard to distinguish depression from changes in mood, symptoms of premenstrual tension, or mood disorders related to menstrual disorders. So yeah, it is all a little bit confusing when you're looking at the research. Just to highlight that it's worth looking out for yourself if you notice that you've had a change in mood or anxiety from recent medications, and if you're looking after clients as well, for sure. It's always something to be aware of. They don't necessarily need to come off the medications, but there might be something else that you can change or you can talk to their GP about. So this is looking at some of the medications that are commonly used for mental illness. Obvious one, of course, is antidepressants. Now, just about all the research does conclude that antidepressants are best used in cases of moderate to severe depression. They are less beneficial in mild to moderate depression. So there are lots of studies out there. There's some conflicting information as always, and some studies suggest that an antidepressant is no more effective than a placebo, and some show clear but small to moderate efficacy. So it's a mixed bag. I certainly know friends and family who have been on antidepressants and they saved their lives. You know, they really made a big difference for them, and it has had a really positive impact. And I know some people that have tried antidepressants and haven't liked them at all. And I think if you think about, you know, when I showed you one of the slides on the first week about all the things that can contribute to anxiety or depression or mental illness, there's such a huge range. And it's quite easy to see when you look at that what might help one person hugely, it may not help another person at all. And so it's really important to have a wide scope when you're looking at treating depression or anxiety, and not just think that one size fits all. So this is where antidepressants, great if they work for you, it's fantastic. However, if they don't work for you, it's so important to keep looking and keep trying other things, because it may be that it's actually a vitamin deficiency, or it may be, you know, it could be a myriad of things. It may be that you need some psychological therapy. It may be that you, you know, need to get out and do a little bit more exercise. I mean, it could be a number of things that contribute to your mood and well-being. And it's important to look at all of those and not think that there's one answer necessarily. So more commonly used for the antidepressants are the more modern ones. They're the SSRIs or the SNRIs, and they inhibit the reuptake of the serotonin and noradrenaline. So these are the neurotransmitters that I talked about on the first week. They basically affect the levels of neurotransmitters in your system. The older antidepressants, there's a few of them. They are still used. In fact, some of the older tricyclic ones are still thought to be the most efficient in treating depression. So even the older ones appear to have a really good treatment profile, and they all affect the neurotransmitter levels in the brain. Some of them really affect inflammation as well. So there are some thoughts about, well, if they're affecting inflammation, is it that the inflammation that's reduced, and that's why the symptoms of depression or anxiety have cleared up. Anxiolytics is anti-anxiety. So, and these generally should only be used for short term. So the idea is that if you use them for the short term while you engage in some sort of therapy or other ways of actually learning how to cope with the anxiety or reduce your anxiety levels. So these are the PAMs. You've got the diazepam, lorazepam. These are the ones that should be given, like I said, in very small doses and for short periods of time, because your body can get used to them. And sometimes if you're taking them all the time, your body needs more and more of them to have the same effect. Sometimes people are given antidepressants to help treat anxiety as well. So if you have a chronic long-term anxiety, the GP may suggest an antidepressant because some of them have anti-anxiety effects as well. Sedatives and hypnotics, these are things to help you sleep at night. And this is a little bit scary, but there are some studies that suggest that the regular use of sleeping tablets is associated with an overall increased mortality. So you're more likely to die from any cause. And this is just having over 18 tablets a year. So once again, don't know the mechanisms behind that, but it's a very interesting study. Antipsychotics, so these are usually used in schizophrenia or to treat people that have got an active psychosis. However, they are also used sometimes to treat chronic anxiety, and so that's something that the maybe a GP, but often a psychiatrist would be more likely to go down that route for anxiety. Yeah, I don't think there's anything more I'll say about the medical side of things. That's just a very brief overview of some of the antidepressants and the medications used. As I said, if you have severe depression or anxiety, definitely I think medication is a great idea. And for antidepressants specifically, they do recommend that you stay on them for about 6 months at least. Do not ever come off them without talking to your GP first. And with regards to what I'm going on to next, which is alternative medicines, it's really important that you check with your GP or with your pharmacist before you try any alternative medicines for depression or anxiety. Some of these supplements have interactions with other medications, and some of these shouldn't be used in certain conditions. So it's really important to check with your GP or pharmacist. Don't just start them. There are definitely some things like St. John's wort that should not be used at all while you're on an antidepressant. Some of them will be okay to be using in conjunction with an antidepressant, but always check with your GP or your pharmacist first before you start these. And the other thing is that herbs and supplements can really vary in their quality. And this can be really difficult when they're studying and doing research on some of these alternative medicines. So it is really important that you choose a trusted brand, and that if you feel that it's making a difference for you, stick with the same brand. Don't flick between different brands. Just stick with what you know, and take them very regularly. Take them regularly as directed. So these are a few of the ones that I've found in the research that have suggested that they have really good efficacy when treating mostly depression. Some of them are for anxiety as well. One of the most common ones is something called St. John's wort. So you may have heard of that. I've actually tried St. John's wort many, many years ago, and I thought it was good. All antidepressants take a few weeks before they kick in, usually a week before you notice any difference, sometimes longer. And I think from St. John's wort, I probably was on it about 10 days, and then I noticed that I was sleeping better and actually starting to feel a little bit better as well. So I found it really nice. I certainly didn't have any side effects from it. And there was some studies done in 9 controlled and standardized trials of St. John's wort. 5 showed that the herb was superior to a placebo, which is what you want in research studies, and 4 found that they were equal to effectiveness when compared with antidepressant. So it works. It seems to work. It's got a good profile. There's a little bit there about the recommended amount. You do need to take it. They do suggest for some of these you take it 3 times a day, which can be a bit of a pain. But it depends. Once you're on it and steady, you might be able to reduce it to twice a day for moderate or mild depression. And once again, don't take that with other antidepressants. 5-HTP is one we also discussed on week 1. It's a precursor to the neurotransmitter serotonin. And so it can really help as well with some forms of depression. If you've got a serotonin deficiency, there's a lot of talk whether that's actually part of a depressive illness or not, but certainly for some people, having serotonin can make a big difference to their mood. There is also talk about a lot of serotonin that you have in your body is actually made in your gut. So taking serotonin for some people actually helps reduce their irritable bowel syndrome symptoms as well. So this is really fascinating. So for some people, they do find that it reduces inflammation in general and can help with their gut symptoms. Tryptophan is the precursor actually before it turns into 5-HTP, rather confusingly. So your body uses tryptophan to produce serotonin, and some people found that the diets fed rich in tryptophan had less anxiety, irritability, and depression. So you can get it as a supplement as well. So you can actually get that just so you can purchase tryptophan by itself. This is the DHA EPA, it's omega-3 fish oil. So there are quite a few studies that indicate the beneficial effect of a combination of the EPA and the DHA, so they're the omega-3 fatty acids in the fish oil. And I think I mentioned this on the first week, that the EPA rather than the DHA, so you want high levels of the EPA influence the efficacy of the tablet to work. The thing with fish oils, also be very careful. You want to make sure that they are very good quality, and you want to make sure that they are tested and have very low levels of mercury in it. This is a real problem with our fish, unfortunately, because we've our waters aren't as clean as they should be. These are a couple of other things. So curcumin is from the herb turmeric, and they have found some studies to show that that can be equal to an antidepressant in some studies. It's safe, it's well tolerated, and for some people they also noted sufficient anti-anxiety effects. Once again, if you're going to buy that as a supplement, you will want really good quality, and ensure that you are taking it regularly and about the same time each day. Rhodiola is a really interesting one. I haven't tried this myself. I would like to. It's called an adaptogen, so it actually supports leveling out, I guess is the right way of having it. So supports the right amount of cortisol, for example, in the body, and so it's very good for stress. And so whether it's long-term stress or sort of if you're having acute stress for a short amount of time, it's been shown to reduce stress symptoms. The study that I looked at particularly talked about burnout, and so when you're feeling burnt out, rhodiola is apparently a really helpful one to we look at SAMe. So S-adenosine L-methionine is a compound that's naturally found in the body. It's found to be, you can take it as a supplement, and it's found to be very good for depression. However, out of all of these ones I've discussed, this is probably the last one I would look at, only because for some people it can cause them to feel quite agitated. So for some people it's fantastic and it works very, very well, but for others it can cause a little bit of anxiety. So I'd suggest not take, try that as a last resort maybe, and do not take if you've got bipolar disorder or, because it's suffering from anxiety. And just a little bit about probiotics. So once again, looking at that irritable bowel, that gut-brain connection. Studies have found that some strains of probiotics do reduce anxiety and depression. I think I looked at one study and all they did was feed people yogurt, amazingly, every day for a month. And one yogurt had extra probiotics in it and one didn't. And they measured people's anxiety scores before and after a month. And amazingly, the people that had yogurt every day with the probiotic in it had less amounts of anxiety. So that's quite fantastic. The other things you can do to support your gut with good probiotic fibre is obviously your diet and fermented foods, loads of vegetables, plant-based diet. That can make a difference too, of course. And this is from week 1. We talked about some of the other vitamins and minerals that support mental health and well-being. So we're looking at B12 and folate, vitamin C, essential fatty acids, zinc and magnesium. So if you're looking at taking any of these, it is really important to have a chat to your GP about it. They might not necessarily agree that it's going to work, but most of them will be happy for you to give it a go, and hopefully will be supportive of you, looking at alternatives and taking, I guess, your health into your own hands. And this is just a little bit about where else you can find help. So if you go to a GP, definitely ask them what else is available for you. But I'm just looking here about other recommended, I guess, people to seek help from. And so you can see a psychologist who is highly trained in various tools and uses obviously talking therapy. Will usually treat quite sorry, that's supposed to say serious disorders such as chronic depression, anxiety, eating disorders. They'll also look at things like sexual abuse. They use often cognitive behavioural therapy or dialectical behavioural therapy, and they're usually very well trained. Now, there's something very important for you to know when you are looking for a therapist or a counsellor or whoever it is that you choose to go and speak to. No matter what their training, the thing that's most important for you and is going to make the biggest amount of difference is whether you have a good relationship with them. So basically, it's whether you feel that they get you and whether you feel that you're both on the same page. So this is incredibly important. You could go to the most qualified person and just find them not very helpful. And likewise, you could go to the least qualified person and find them incredibly helpful, and that you have a good relationship with them. And there's been studies to actually show this, that it's not about necessarily the type of therapy that they give you or anything else. It's more about the relationship. So this is really important. So if you do go and get some counselling, or you go and see a psychologist, and you go through, you've got to give it a good go, but you go 3 or 4 times and you think, you know what, I just don't feel good about it, or I don't feel like I'm getting anything out of it. Don't think that there's something wrong with the therapy or that there's something wrong with you. Do feel free to go and find and have a look for someone else that might be more appropriate for you. So I just think that that's really, really important. I've often said to people, just keep, there's a difference between keep looking and not being satisfied with anyone, because then that probably is a problem. But actually, do feel free to have a good look around and actually find someone. You can phone them up first and have a chat to them on the phone and see if they're people that you feel that you're going to connect with. It's just so incredibly important. So a psychiatrist is a doctor who specialises in psychiatric conditions, and so they are able to prescribe medications for you. Many psychiatrists do a little bit of therapy as well, but some will definitely do a little bit of therapy, but generally psychiatrists are often used because they have expertise in specific medication, and especially if you've got a treatment-resistant depression, so a depression that hasn't responded to antidepressants in the past. However, as we've already discussed, there's lots of other things that you can try and look at as well. The other thing is counsellors. These are usually registered, so there's a body of counselling that they can register through and with. They also use variety modes of talking therapy. Usually they're not as highly trained, I suppose is the right word. They don't usually deal with serious mental illness. I've been to counsellors in the past. I've been to some that are incredibly helpful and really, really useful, and I've been to others that I sort of thought, in fact, I've been to psychologists that, I haven't found particularly useful. So once again, just keep looking and find someone that you connect with. And I think it's really important to not be ashamed about going and getting help. I know for myself that if I'm struggling in my life, one of the first things I will do now is go and talk to a professional about it, because there's nothing more useful than sitting down with someone. I mean, you get an hour, sometimes more, to talk about yourself and your problems and try and just nut out what's going on. And that is so incredibly useful. It's such an incredibly useful thing to experience, and I just highly recommend that you do it. Don't be put off, don't be embarrassed, don't be ashamed. Make a phone call, have a chat to someone, ask around your closest friends if they've been to see someone, because it really can be life-changing. It could be something that really does get you out of the difficult place that you've been stuck in for a while. These are a few other modalities. So you're looking at a psychotherapist. A psychotherapist is usually, I have not ever seen one myself, and I don't really know, so I haven't experienced that process, but it's usually very long term. They delve into quite sort of a lot of your past issues, and generally long-term therapy. Once again, psychotherapists might they might practice other modalities. So a lot of these cross over too. So a psychotherapist might do short-term CBT, for example, cognitive behavioural therapy, and yeah, so it's once again find what you think is right for you. A health or a life coach. So I'm a nurse, but I'm also trained as a life coach as well. And a general life coach doesn't necessarily mean that they're associated with any professional organisation. Obviously, I'm associated with my nursing organisation. They're generally not used for deep psychological issues, and it really is more of a short-term, forward-focused. It's about achieving goals and moving yourself forward. So you do need to be in a reasonably good place to engage with a life coach. And these can vary hugely, so absolutely shop around if you're looking at life coaches. And I've just put in here as well community mental health. So community mental health centres are the government sponsored centres, government paid, funded centred. They have multidisciplinary teams. They'll have psychiatrists, psychologists, social workers, nurses, all working together. These are usually for what they call the 3%. I'm talking about, these are the people with serious mental illnesses. And so, you may be referred to them short term if you have long term psychiatric issues. But generally, if you're suffering from a mild to moderate depression, you're unlikely to get referred to a community mental health centre. But just to let you know that they are definitely out there. This is where the crisis team would be based from as well. So if you are dealing with anyone that is acutely suicidal, these are the people that would normally come in and deal with that from the community mental health centres. So this is just the timeline, putting it all into practice. And so we've got first thing to do is make an appointment with your GP, ask for full assessment and full bloods, write down anything that you might want to ask, and don't be scared to ask for a copy of your blood test, and so that you can actually have a look at them exactly and see what they look like and what's normal or what's not normal for you, and I've kept all mine, and I look over the years and sort of have a look and say, oh, well, it's nice to see that my iron levels have improved over the years, or whatever it might be, because these things are really important for you to know and understand. When you see your GP, discuss what other options are available, counselling or therapy. If they do prescribe you sleeping tablets or something for anxiety, use them short term and sparingly while they support you to go and get help. Actually, that's the idea, because it's very hard to engage in any sort of therapy if you're so anxious you can't get out the door. So the idea is to use the medications such as anti-anxiety medications short term to help you engage in the therapy or any other practice that you're going to do to help you get better. Antidepressants, obviously, as I've said, you do need to use them for about 6 months or so. Seek support, so look outside your GP for psychological, psychiatric support. If you've got a GP that's with ProCare, you might get free counselling. Often there's a long waiting list, but it is available. ACC does provide some counselling for specific trauma-related issues, so that might be available to you. Some GPs do green prescriptions, which may include things like going to the gym, which would be wonderful. And like I said, the community mental health centre for more serious cases. And it's really important to keep your GP in the loop. If your symptoms get worse, go back to your GP. Don't stop your medications without discussion with your GP. So this is, I think, hopefully going to be a little bit helpful for you just to understand what you can expect when you go and see your G, what sort of things you might want to ask about blood tests and about other services available to you. Like I said, I think the GPs have got an incredibly difficult job trying to help you all in 15 minutes. And I think it's really up to up to us as well to actually sort of think, well, what do we want, what do we need, and how do we approach this with a little bit of knowledge, and really to help ourselves or to help the people that we care for, and know that we're on the right track. And that is it for this evening. So thank you all very much for joining. I hopefully will send this out as much as